right, so now we're going to assess our neurological system. That is going to be done with cranial nerve tests. We have 12 cranial nerves that we'll be testing, and then we're also going to do some deep tendon reflexes. So number one, our first cranial nerve is our olfactory nerve. So for that, I'm going to have my client, Mr. B here, smell one nostril at a time. So plug one up. Other side. And what do you smell?
Lemon.
Beautiful, and it is lemon essential oil. So we know that that is intact. Next, we're going to do our optic nerves. That's cranial nerve number 2. So for that, I'm going to have my client cover one of his eyes, and I'm going to do the same to mine. And I'd like you to tell me when you can see my fingers move, okay?
No. No. No.
And other side?
No. No. No.
Beautiful. All right, and then we're going to assess our cranial nerves 3, 4, and 6 all together. 3 is our oculomotor nerve, 4 is our trochlear cranial nerve, and then 6 is our abducens. We're going to be doing that with testing perla, eye accommodation, and then our cardinal eye movements. All right, so we're going to do that with our pen light here. First, we're going to test perla. So perla is done by shining a light in one eye at a time. We want our pupils to be equal, round, and reactive to light. We want to assess for any abnormal dilation or anything abnormal in our eye movements that way. So, sir, I'm going to have you just look straight ahead at me, all right? And you're going to have a light shine in your eyes, okay? Awesome. So we see our eye brisk constriction, which is what we want, and normal dilation to constriction. Perfect. All right, now we're going to test for accommodation. We're going to do that by having our client focus on something behind me. So I want you to look at something kind of in my line of view, kind of look past my ear. Just look right past my ear. Okay, and then I'm going to hold a finger up to close to your face, and then when I ask you to focus on that, I want you to focus on my finger instead, okay? So we're looking past me. Now look at my finger. Awesome. So what we're looking for is that his eyes constrict or constrict when they look at something close up to them. So that's accommodation. Then we're going to do our cardinal eye movements, okay? So I'm going to have you just follow my finger with your eyes. And what I'm looking for here is I don't want to see any lagging eye movements. I don't want to see nystagmus. I want to see just kind of smooth, equal eye movements, and that he's able to go to all fields. All right, so just follow my fingers with both of your eyes, okay? All right, good. So he was able to do that very well. So all those things checked out. Now we're going to do cranial nerve 5, which is our trigeminal nerve. So I'm going to take something and I'm going to touch your face. Close your eyes for me. And I want you to tell me when you can feel me touching your face, okay?
No. 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 No.
All right, perfect. So all of that looks good. Now we're going to do 7, our 7th cranial nerve, which is our facial nerve. I'm going to ask you, sir, to smile for me, nice and bright. Good. I want you to scrunch your eyes up real tight. You can stop smiling. And then raise your eyebrows. Beautiful. So what I'm looking for here is even movements, an even smile, kind of even strength in shutting his eyes, and just overall a symmetrical looking face. Now we're going to do cranial nerve 8, which is our acoustic nerve, and we're going to test that by doing a whisper test. So for that, I'm going to stand behind my client. Sure you can see. Stand behind my client, and I'm going to whisper something, and he's going to repeat it back to me. I'm going to do that on both sides. All right, so for this one, I'm going to close this ear. I'm going to whisper something. I want you to repeat it back.
3, 5, 6. I would like sushi for dinner.
Beautiful. All right, so our cranial nerve 8 is intact. Next, we're going to do cranial nerve 9, which is our glossopharyngeal nerve. For that, I'm going to stick a tongue depressor in my client's mouth, and we're going to say ah. For this, I will not be sticking this directly in his mouth, as this is a nail filer. Stick your tongue out for me, please. All right. Good. And what I'm looking for here is his uvula here. I want it to kind of move back and forth. 10, cranial nerve 10 is our acoustic, or it's called our vagus cranial nerve, but it's our voice. And I've been listening to his voice. It's smooth, it's clear, it works. It's great. Next, we're going to do our cranial nerve 11. Which is our spinal accessory nerve, and for that I'm going to be having my client raise their shoulders up and down. For that, I want to see nice even movements and even strength. So shrug your shoulders, and again, good, that's good. All right, so then our final cranial nerve is our hypoglossal nerve, and that's cranial nerve 12, and so I want you to stick out your tongue. Good. And what I want to see there is that his tongue does not deviate to any certain side, and that it's kind of straight, symmetrical, and he's able to do so. All right, so next we're going to move on and do our deep tendon reflexes. So for that, I'm going to take my reflex hammer, and we're going to start that off. So